I also want to share a few other points that I think are real important at this time as we just discussed this critical thing. The fact is that what we need is a real focus on patients, not profits. The way the health care proposal is working now, and the draft looks, is that there are basically three prongs. One is employer-based health care insurance. If you like the insurance you have, you can keep it. Don't listen to that stuff you heard in the last hour, Mr. Speaker. The truth is you get to keep your health insurance if that's what you want. Two, people who are over 65 or who qualify for Medicaid can get health insurance. Those folks who are in those government programs already can share in that benefit. But the third option is this exchange where private insurance plans and a public option will be available for people, and people can bid on these options and purchase their health care. There would be a subsidy of up to about 400% of the poverty guidelines. We would ban the exclusion of people with pre-existing conditions. And there's a proposal that anyone who wants to put their plan in that exchange would have to have a medical loss ratio of about 85%, which would mean that actual health care delivered to people, the money would have to be 85% of their overall budget, and that 15% would be on administrative costs and other things like that. Medicare already does a whole lot better than that, and so does the VA. So that's basically an outline, Mr. Speaker. That's basically what it is. But I just wanted to just make sure that we really hit this idea of this public option tonight. Our system wastes roughly about $700 billion, that's billion with a B, on treatments and procedures that cannot be shown to improve health outcomes right now. A public option would make just charging these kind of fees to just generate money something that you really can't afford to do, because you got real competition that's not that's not driven by profit motive, but is driven by the quality health care. The fact is, Mr. Speaker, we need ways to drive waste out of the system, and we need ways to make private insurers really compete with this public option, which they will not do. As you know, Mr. Speaker, under the McCarran-Ferguson Act, insurance companies are not required to compete with each other. They have a tax exemption. No, excuse me. They have a exemption from antitrust laws, and therefore can legally collude. And so we need this public option so that we can make them actually compete. You know, Mr. Speaker, I don't have to get up here and tell you or anyone else that health care costs in America are crushing America's businesses and families. But I will offer a few examples. Our manufacturers spend more per hour on health care than they do their counterparts in Canada and Japan and UK combined. What I'm saying is that if you have a company that is international in scope and has places in Canada and subsidiaries in Japan and UK, that's, you know, England and the United Kingdom, their American manufacturers spend more per hour on health care than all these other subsidiaries combined. That's making America non-competitive and putting us at a competitive disadvantage. Mr. Speaker, I bet you didn't know, and maybe you did, that health care costs for small businesses have grown 30% since the year 2000 alone. We need health care. We need a public option. The average family premium costs $1,100 more per year because our health care system fails to cover everyone. The average individual premium costs $400 or more. Mr. Speaker, we need a public option. We need health care reform. In 2004, half of all people filing for bankruptcy cited medical problems as a cause. That's half. Well, Mr. Speaker, I got a chart right here, and where this is definitely an out-of-date figure because that's much higher than half now. Medical bills underlie 60% of U.S. bankruptcies, according to a recent study. Washington, Reuters, that's the news company, Medical bills are involved in more than 60% of U.S. personal bankruptcies, an increase of 50% in just 6 years. U.S. researchers reported on Thursday. More than 75% of these bankrupt families had health insurance but were still overwhelmed by their medical debts. The team at Harvard Law School, Harvard Medical School, and Ohio University reported in the American Journal of Medicine. Quote, using a conservative definition, 62.1% of all bankruptcies in 2007 were medical. 92% of these medical debtors had medical debts over $5,000 or 10% of pre-tax family income, the researchers wrote. Quote, most medical debtors were well-educated, owned homes, and had middle-class occupations. Now, Mr. Speaker, this scenario is what the speakers in the previous hour were trying to defend. Is that not crazy? That is not what the American people want. That is not what the American people deserve. The speakers in the previous hour were literally defending this system and standing in the way of reform. Few more facts, Mr. Speaker. In 2008, just last year, half of all people filing home foreclosures cited medical problems as a cause. Again, medical problems in our broken healthcare system deeply implicated even in the foreclosure crisis. The fact is, high costs lead to people losing coverage. 14,000 Americans are losing coverage every day in the midst of this economic crisis. The numbers are staggering, and at some point, your eyes just gloss over, and you can't really hear them. So sometimes numbers don't even bring as much light to the subject as one would want. But let me just say, 14,000 Americans are losing coverage every day in the midst of this economic crisis. Why? Because as unemployment creeps toward 10%, when you lose your job, you lose your health care, because we have an employer-based health care system. So, Mr. Speaker, again, serious problem. Last month, 400,000 plus jobs lost by Americans. Every one of them is either dealing with no health care or has to carry an enormous COBRA payment on their back. Mr. Speaker, that's not good. 60% of Americans say that they or a member of their household have delayed or skipped health care in the last year. 60% of Americans say that they or a member of their household has delayed or skipped health care within the last year. Now, Mr. Speaker, we need to reform our health care system. I hope that's obvious to everybody. Maybe it's not. Actually, you and I both know it's not obvious to everybody, though we wish that it was. But let me just talk a little bit about it for a moment. Bring up our poster. Nope, lost it. Bring back up this poster, Patients Before Profits. Mr. Speaker, reform will alleviate the burden on families by lowering costs. Ensuring timely access to affordable, quality health care, making sure everyone has access to preventative care, will help keep the American people healthy and allowing workers to change jobs without worrying about losing health care. Imagine being stuck in the job you have. Maybe you don't even want to be there, but you can't leave because you got health care.